Hello and welcome to the WAITS 2015 Hashtags and HIPAA webinar. I'm Mary Starks, Senior Marketing Manager from Wolters Kluwer. I'm going to quickly go through some housekeeping issues with you guys. On the right-hand side of your screen, you should see a menu. Please use the Q&A menu bar located on that right-hand menu to submit questions, as all lines have been placed on mute. There are handouts for today's webinar, both slides and a white paper for you to download. You can find those in the handouts. To download a copy of today's presentation, just select that Handouts tab and follow the instructions. We will also send out those handouts and the slides with the follow-up emails from today's presentation to everyone who attended. Today's webinar has not been approved for any CLE CEUs, as it is only half an hour long. With that out of the way, I am pleased to pass things to Jenna Ellis. Jenna?
Hi, everyone. Thanks, Mary. As Mary stated, I'd like to welcome everyone to our WAITS webinar. WAITS is What Are the Experts Saying? And today we're going to talk about hashtags and HIPAA, which is actually healthcare compliance in the age of social media. And I, again, am Jenna Ellis, and along with Dan Totolo, we are your moderators today. And as Mary said, if you have any questions during the presentation, please feel free to send them in. And we will take care of any questions for the expert toward the end of the webinar. So with that, I'd like to thank our expert for being here and, of course, introduce her. She is Catherine Beard. Catherine is a writer-analyst for the Health Law editorial team here at Wolters Kluwer, and she's also the lead editor of the Law and Health blog. So thank you so much, Catherine, for being here, and welcome.
Hi, thanks. It's great to be here.
So also one thing Mary said, and I just want to reiterate because everyone always asks, is if you want to read Catherine's white paper, you can download it on the attachment area of your menu panel on the right-hand side. It's a great white paper that she did, and it's a great companion piece for today's webinar. So let's kind of jump right in, Catherine. Let's talk generally about social media, because I think so many people use social media nowadays, but how does it relate specifically to healthcare compliance? What does it mean?
Well, in the broadest sense of it, social media is a way of sharing information with others through technology. In terms of healthcare, social media can be used by a provider or by an individual at a large or small scale, which can all affect compliance with federal laws and regulations.
Okay, so do you mean like Facebook, Instagram, the things that people use on a daily basis?
Yes, both all those, but also there's other uses. Providers may use review sites, for example, like Angie's List or Yelp. They can also use professional listservs or message boards or really any other sort of social media.
You know, and we have a slide up here with Angie's List and Yelp, as you just said, and I know we'll kind of circle back and hit on it a couple times in this presentation, but I think it's really interesting to note that on these review sites, the doctors or the providers are actually a lot of times ranked, right? Ranked and reviewed.
Yes.
Okay, so we all know what social media is now. Let's talk about the benefits. From a provider-specific standpoint, what are the benefits for using social media?
Benefits include advertising, patient engagement, disseminating general health information, and connecting with colleagues for support or to consult on a rare or a challenging health issue. Social media allows providers to realize many of these benefits all at once rather than individually. For example, a couple years ago, UCLA performed a surgery where they implanted a brain pacemaker in an awake patient. During the procedure, they live tweeted what was happening and Instagrammed photos and video showing the patient playing guitar to guide the surgeon's electrode placement. Similarly, last year, Baylor live tweeted a heart transplant, including pictures of surgery prep, organ delivery, a heart-lung machine that kept the recipient alive during the procedure, and the successful EKG at the end of the procedure. These uses advertise the skills of the surgeons in the hospital. They raise public awareness about available health services and the need for organ donations. And they also can show other providers around the world some of the procedures that facility is using.
I think that's really exciting, and we can all agree that a lot of exciting things can happen on social media. And I know one time you mentioned the Cleveland Clinic.
Yeah, the Cleveland Clinic is an example of a health organization that's really using social media well. Between their blogs, Twitter, YouTube, and Facebook, many of which cross-link to each other so they can reach users on multiple platforms, the clinic gets its name in front of potential patients, establishes itself as an expert and an innovator, and is able to show a behind-the-scenes view of its work. Recently, they tweeted a time-lapse video of a surgery. They posted pictures of 3D printed reproductions of organs. This bronchial tube model was used to help fashion a customized stent for a patient. They also use it to sort of humanize themselves as an organization. They're cheering on one of their nurses who is currently competing in the Rio Olympics for the Armenian gymnastics team.
I think, again, those are really exciting, a lot of benefits, but there can also be some challenges, especially, of course, in the medical field, right?
Yes, definitely. You know, when you're speaking about social media, the main benefit and the main detriment is how easy it is for information to spread to a huge number of individuals across the whole world in a very short period of time. That can become a huge problem when the spreading information is protected health information, or PHI.
So what are some, I guess, what are some examples of these kind of breaches or issues that people have?
Well, the most obvious ones would be a malicious breach, where someone actually means to post something that they otherwise should not be posting. For example, yesterday, CMS sent a letter to state survey agency directors about social media abuses of nursing home residents and the need for states and facilities to take steps to prevent staff from taking and sharing pictures and videos of residents that are nude, using the toilet, or otherwise in a compromising or humiliating position.
And those are kind of malicious examples, like you said, but I think some of them, you know, they can be harder to call, or they're more subtle, right?
Yeah, HIPAA can be violated in many ways, and not all of them are as clear-cut as the nursing home abuses. The more subtle violations, which are also the more ambiguous ones, are what providers really need to be aware of and work to prevent, because they're often the result of negligence rather than malice. Negligence could be a medical student taking and posting a selfie to celebrate their first day of a rotation, but the background of the picture is a whiteboard that lists patients' names and conditions. An inadvertent breach could also occur if a provider tries to remove identifying characteristics from a post, so with the best of intentions in attempting to not break HIPAA, but they don't exactly succeed. You know, a small-town nurse could write on a Facebook page, where it's also listed on her page who she works for, that she had a rough day caring for a 5-year-old who's dying of cancer. She might not post the child's name or other forbidden information, but there could still be enough details for a member of that community to use a little detective work to figure out who that patient is. The review sites like Angie's List or Yelp add an additional wrinkle for providers. If they fail to respond to a poor review, they could be seen as uncaring, but there's a very fine line between responding to a complaint with empathy or rebutting a criticism and disclosing PHI. In May, the Washington Post interviewed providers who were contacted by the HHS Office for Civil Rights, or OCR, about Yelp-related HIPAA complaints. These providers had responded to negative reviews by saying what symptoms the patient presented, how the provider treated that issue, and why it was an appropriate treatment in violation of HIPAA. Providers can respond to negative comments. Indeed, they might feel pressure to do so due to the rankings that these review sites create for the public. However, the safest responses are general and neutral, such as, "We take all complaints seriously and ask that you contact us directly to discuss this issue." Even if the individual posting a review shares their own personal information, the provider should not do that in response at all. You definitely should be on the side of caution in that situation.
Definitely. So those are those, you know, I guess, consumer-facing platforms in social media. So that's Facebook, Instagram. Those are platforms like Angie's List and Yelp. But what about violations when maybe people, you know, think that they're protected because there are, you know, passwords or whatever other protocols in place?
You know, even in the social media context that only allows, for example, licensed providers to access the shared information. So a listserv or a forum that membership is limited to people who can prove that they are licensed providers. PHI can still be wrongfully disclosed. You should only ever disclose as much as is necessary, and continue to protect online your patient's confidentiality just as zealously as you would in person.
So those are kind of also, if we categorize them, all kind of HIPAA-related challenges. What other types of challenges do people need to be aware of?
For other pitfalls include damage to reputation, which could be the reputation of the individual, the health organization, or the entire medical profession. Damage to reputation could open the provider to discipline or sanctions from accrediting organizations or to an adverse employment action. A New York doctor used Instagram to post a picture of an emergency room surgery room after performing surgery on a person who had been hit by a subway train. A nurse reposted the picture, but she added a caption, "Man versus 6 train." And because that caption was seen as insensitive, she was fired from that job. Social media could also be a factor in civil lawsuits, like medical malpractice. If the provider's Facebook page is used as evidence and shows that the night before the procedure in question, he was out drinking margaritas, it could lead the jury to believe that he was not fully capable the next morning. Social media could also make a trial more difficult or lead to an early adverse settlement. A Boston doctor who called himself Dr. Flea had a popular anonymous blog about his job, but he was involved in a medical malpractice lawsuit, and he wrote about that as well, including details about the case while it was pending. The blog was discovered by the plaintiff's attorney, and under oath, they asked the doctor just 2 questions. Do you have a blog, and are you Dr. Flea? He said yes, and the lawyer moved on, but it was enough to let him know that they had his blog and they were willing to use the information that he had posted on there against him. The case settled the next morning. So you really need to be aware that what's out there could harm you in many ways.
Definitely. And so I think, no one needs to be convinced, but we all need, especially if we're charged with compliance, we have to have some kind of compliance policy. So where do these people go, or where do you go first?
Well, the important thing is that you must act, but you should not overreact. You can't ignore social media. It's not going to go away, and pretending it's not there will just lead to problems. But you also can't overreact. You can't attempt to ban all social media. It's a losing battle, and you would be giving up all of the benefits that social media can provide to you. Even if you don't think it applies to your organization, you still need to have and implement social media compliance policies and procedures. The good news is you don't have to start from scratch. All federal healthcare programs require participants to have active compliance programs, including written policies and procedures with training and record-keeping requirements. A social media policy will be an integral part of your existing compliance program, and many of the same principles used already will apply for social media. For example, most compliance programs already have a structure to review and update the program on a regular basis. If you don't currently have a social media policy, all you need to do is put it on the agenda for the next meeting and follow your regular procedures to start drafting one. You should make the policy as broad as possible to allow for new types of social media or even new uses of existing technologies. A few years ago, people weren't taking pictures with their cameras on their phones. They were getting film developed and waiting for them. And now everyone is using selfies across all generations, not just teenagers anymore. So that's a new use of existing technology, and you need to be prepared to know that things might change in ways that you can't foresee.
So if you have this policy, so if you created it, how then do you get the word out to your employees?
Employees find out about the policy when you implement it and train them. There are really 3 main times that you should do trainings on your social media compliance policies. First is when it's first implemented as new. All of your employees and staff need to attend a comprehensive training, and that's probably the longest session you'll need to have because you're introducing the topic to them. Then when you conduct refreshers on your policies, whether that's an annual retraining or when you update your policies and you bring that out to them, you should include the social media policy in those refreshers. The third time that you should really train people on this is when an incident involving social media compliance takes place. It's a great opportunity to assess what problems led to the incident and how you can adapt the policy or provide directed training or clarifications to prevent future similar occurrences.
So you've created the policy, you've implemented it. What specific things should be included?
The main issue is that if the information shared would be a breach in any other context, it's a breach in social media. This can be known as an elevator shop or a coffee shop or an elevator policy. If you wouldn't say it in a coffee shop or in a crowded elevator, you shouldn't write it on social media. Similarly, if you wouldn't want to see the picture on the 6 o'clock news or on the front page of the local paper, you should not post it online. However, because of the way social media can spread so quickly, organizations should consider encouraging employees to report possible breaches, both by others and by themselves, which will then give the organization the opportunity to begin to investigate and mitigate a problem as early as possible. If you have a hotline, you should allow your employees to anonymously request an opinion about a potential social media post before it goes live to make sure that it won't cause problems.
And then what other, or I guess, is it just social media and that policy that we're talking about, or are there other updates in related areas that need to be updated in your policy?
Your other policies can be affected by social media. For example, an acceptable use of technology policy may need to be updated to prevent employees from using or accessing social media during their work hours, or from using the organization's computers to use and access social media. Similarly, the professionalism policies of the organization may need to account for online behaviors and activities.
So let's talk, let's say that you have this policy, you've created it, you've implemented it, but if something happens, or if you do get audited, which maybe you should be, I guess, and you'll talk about that, but what happens if you do get audited?
Well, for purposes of this webinar, we'll talk about two main types of audits or investigations, though others are certainly possible. First, healthcare organizations should conduct internal audits for compliance with their policies and procedures to test the currency and implementation of them, and also as practice. This will help you know what to expect from and help you prepare for an outside audit. Organizations should also do internal investigations in response to a potential violation to determine whether a violation has taken place and to take steps to mitigate any resulting damage. In terms of an outside audit, the HHS Office for Civil Rights, or OCR, can conduct audits either as prevention or in response to a complaint. For either type, the OCR will give you written notice of when the audit will be and what information you'll need to compile for them, as well as which individuals you will need to make available for interviews if necessary. If you've been doing internal audits, your documentation and personnel will be better prepared for the OCR, and the whole process will run much more smoothly. Importantly, if the OCR does determine that you have violated HIPAA, the existence of your policies and procedures and what you did in response to the breach can save you from the worst sanctions.
So let's talk then about, okay, so we have the internal audit and then the OCR audit. If there's any findings, do you want to talk about damages? What happens with the OCR and their audit?
If the OCR determines that you did violate HIPAA, the penalty depends on how severe the violation was and whether you're a repeat offender. At a minimum, you have to notify any individuals whose PHI was involved in the breach. For larger breaches, you may also have to notify the press or the HHS secretary. For a low-level violation, you might just get a letter acknowledging it from the OCR. But if it's severe or repeated, the OCR can impose civil money penalties, or CMPs. If they do, the actions that you have taken to mitigate the damages caused by the violation can save you up to $40,000.
So this is slightly out of order, but I think it's a good question to bring up. One of our attendees asked, who performs internal audits?
That should be your compliance department. But
Okay.
if you do not have an in-house compliance department, there are external compliance companies and organizations who you can bring in to do one as if it were an internal audit.
Okay. All right, great. And we'll take the rest of the questions, of course, at the end. So there's a lot of information that you've reviewed, and I think a thread that has continued throughout this entire webinar is that social media is constantly changing, either new social media platforms or different uses of current ones, right? So what are you following, Catherine? What are you looking at in the future?
A couple different things. I'm keeping an eye on new social media technologies and how they gain users. For example, at the beginning of this summer, live video services were not widely known, but after the Democrats in the House of Representatives used Periscope and Facebook Live to broadcast their gun control sit-in while C-SPAN's cameras were turned off, use of those services has skyrocketed, as well as knowledge of them. In terms of upcoming regulations from the federal government, the best predictor of their future action is looking at congressional committees and subcommittees and what investigations they're doing. Recently, there were some congressional investigations into ransomware, which is when data can be stolen and held for ransom and you have to pay them off to get your data back, which if you're a healthcare provider and the stolen data is PHI, could be a huge, big problem. That led to an OCR guidance document last month on HIPAA and ransomware. Similarly, yesterday's CMS letter about the nursing home staff with the pictures of residents, that was the result of a ProPublica report from 2015 that showed, I believe, 47 instances of social media posts with this kind of content. In this case, CMS followed up by reminding facilities and state agencies of federal regulations against resident abuse. Paying attention to investigative reporting, like the ProPublica story, will also give you an indication of what will be coming next from the federal government.
Great. Well, I think that even though everything is changing, this is a great starting point and some great information for compliance and procedure. So thank you so much, Catherine. Thanks for being here.
Thank you. My pleasure.
And Dan, do we have any other questions? I know I kind of fielded that one in the middle, but any other questions from the attendees that weren't answered?
Yeah, there are actually. Somebody had asked if there is any kind of or if we're aware of an auditing tool that providers could use for conducting their own internal audit, like a HIPAA-related, to help them prepare for, say, a HIPAA-related audit. Is there a generic tool or?
We make.
I'm not sure. Sorry, go ahead, Mary.
Yeah, we make a tool called the Information Security Assessment Manager. That's a part of our ComplyTrack suite that certainly does allow you to do full HIPAA audits based on a set of controls. So yeah, if someone's interested in that, I could certainly have someone follow up with them post-webinar.
Oh, terrific. And the other question was just about replying on Yelp or one of those types of sites. If somebody brings up, I think you may have mentioned this, but just to reiterate, I think, the question was if somebody brings up their information, how much can you reply to that if somebody brings up their private information?
I would recommend replying not specifically, in a very general sort. Again, just thank you for contacting us about this issue. Please contact us directly. We care about our patients. Don't engage them with their specific information. They're allowed to put it out there, that's fine, but if you respond to that and include some of that, it could be a problem, and it's best to completely avoid it.
Okay, great. I'm just looking at the rest of the questions really quick. I think that was the last one that we haven't answered. Other than, of course, the PowerPoint slides are attached. Mary, I think you already mentioned that. A couple people are asking if we'll get the slides. They're attached here to the meeting under attachments. I think was the other.
They are in the
attachments. Send them out
in the handouts tab, but we will send them out as a follow-up email to everyone who attended today.
And I just wanted to say one more thing about that follow-up email. There's also a super quick survey, like 1 minute, and that your opinions on that survey help us choose topics that are important to you. So we would love if you would take a minute to fill out that survey as well, so we can keep giving you webinars that are important to you on topics that are important. So thank you again, Catherine, so much for being here, and thanks everyone for taking time out of your day and attending. And this is, again, the WAITS webinar, hashtags and HIPAA. Thanks, everyone. Have a great day.